Ladies and gentlemen, welcome to our latest podcast. Now, this is a very important podcast because this is a podcast that will benefit women that are pregnant, and it's about a company that just landed a really big deal. Now, before we get on with this, I just want to advise everyone this is not financial advice. Do your own research. You know the disclaimers. Speak to your financial advisor. We are talking to Anoushka from the CEO of HeraMed. The ticker is HMD. How are you today?
I'm very well. Good to be here with you, John.
Absolute pleasure having you. Now, for our viewers out there and listeners, please tell us about HeraMed. What does it do?
So, HeraMed is working in the space of maternity. We go from pregnancy all the way to postpartum care. What you might not know is pregnancy care has not changed for 100 years. It's hard to believe that we are today 2025, and a lot of the care that happens around the world is pretty much what our great grandmas were told to do: show up at the hospital or your care provider or your midwife X number of times during your pregnancies. We believe with technology, with education, and with the way of life, this industry is ripe for change. So, HeraMed is a hardware, software, and data company working in the space of maternity and pregnancy. So, we have our own fetal heart rate monitor, the HeraBeat, and this is where the company was founded. To support that, we created the software, the HeraCare platform, and that's the biggest part that has actually evolved over the last couple of years. So today, the HeraCare platform is device agnostic. So we connect into our own fetal heart rate monitor, but also with a number of vitals that are measured through pregnancies: blood pressure cuff, glucose monitoring, temperature, weight, as well as a number of assessment-based screening for mental health, for instance. So all of that is packaged in the platform along with educational content that is then delivered to a mother through her care team based on her pregnancy condition. And in that process, we are also capturing very important data and measurements to continue care in between visits, in between touch points that a care team would have with the mothers.
So, can you speak to the client base? We're not just talking about, um, you know, double bay mums here. We're talking about, particularly in America, how this is a very important product.
Yeah.
Speak more to that.
Yes. So look, the US is really a big target, big focus for us, and partly because the problem is massive there. So more than 60% of pregnancies are high risk, with hypertension and gestational diabetes being the biggest cause. Now, in the States, more than 36% of the country do not even have one maternity clinic. So there's very, very little access to care. And we know globally there's a shortage, and a growing shortage in the workforce. There's only so many OBGYNs, only so many midwives that are available. So when you look at all of that, so we're really using technology to build access and as well as build more equity in care. So yes, a mum living where, in suburbia, living in the city could use our platform. However, it's also very much for the mother who may have been on her third pregnancy and never had care before. In the US, we launched last June with Broward Health, one of the top 10 health system. They have a very large underserved population. And we have now more than 400 mothers who have been through the platform. And as I mentioned, some of them, this is the first time they're having care. Um, it is really changing the way that they are able to access this, because about 50% of the visits can be done remotely. In between any touch point, they could be having their measurement monitored. If their blood pressure is too high compared to what it should be for them, there are triggers and escalation of care. She needs to take maybe another blood pressure measurement, but the hospital is also made aware that something needs to be resolved. We've also launched all our care in Spanish, again, to meet that demand. Perhaps the other biggest telling part of this is we started our program with them with 4 different customized care plans. 3 in pregnancy and 1 in postpartum, so up to 6 weeks after delivery. At the end of last year, we had 9 care plans, 6 in prenatal care and 3 in postpartum care, all the way to 12 months after delivery. So really our innovation is responding to this evolving demand that the market has to really meet a very specific and big need.
So tell me, what's your motivation to be the CEO of this company?
Look, every day I wake up, I'm here being able to do this work. But what really, give us all a lot of joy as a team is when we hear a story about a mother who has had her midwife or her doctor look at her measurement and make a decision right there and then, for instance, show up at emergency and deliver a baby in the 4 hour window, for instance. Someone like that would have been missed, perhaps. Or we have early detection of complications like preeclampsia that is being picked up before before a blood test will be able to pick that up. Probably, I mean, very, very, very sad in a way, but also one of the lucky moms. She was able to also get help in that postpartum care where um, she was at a very low point, and anxiety, depression is very high. That mental health component in postpartum is huge. In fact, suicide in postpartum is the highest killer for mothers, and it happens 5 to 6 months post delivery. So we were able to pick up on some of those messages and bring her care right there and then. So when I hear this, it just makes it really, really very compelling to be able to do this. And because it is a software solution, what we're doing, we're taking you look at a clinic, for instance, we are able to give them a tool that allows them to look at many mothers at the one time. We have also a triaging system that is, we use red, light, red, green, amber. So any of the cases that appear in red needs to be resolved. So that ability to triage the cases that are very urgent and need help right away is happening through the platform. Um, each visit is optimized by 10 minutes. So we are actually augmenting their capability in being able to see more mothers and still provide that same level of care that they would have if they were doing everything face to face.
It's such a critical and important role. Now, moving on to the commercials now, I
Yeah.
just wanted to say congratulations on the Garmin deal. For the viewers out there that are not aware, please tell us more about this great deal.
Look, it's taken a bit to get to this, but we are extremely, extremely pleased with this partnership. Garmin is committed to women's health, so this is really at the right time of bringing these two brands together. So Garmin it does all the wellness, lifestyle. It's capturing all that information, and we bring in our clinical level data points. So from a data integration point of view, it's really interesting. But what does that mean day to day? I mean, you're pregnant for 9 months and you have another 12 months of postpartum. But what happens before, during, and after pregnancies or in between pregnancies are all very, very relevant in someone's health, not just in their pregnancy health. Through these measurements on how someone moves, eats, sleep, plus a very specific measurement based on their pregnancy condition, we are able to really build a much larger data bank. That also empowers the woman themselves to be able to be in control and aware about their own health as well as their care team. And really, digital health is changing. So being able to work with a partner who's future focused and bringing an element that complements that what we do is super exciting. What can we expect, I guess, moving forward is we'll be looking at where we can bring the Garmin data and our data together, look at what trends, what patterns we can see from there, and then take that forward. It enhances our data as an asset strategy that the business has. Women's health has been under research, so already there aren't that many, information or data set that exists, let alone maternal or fetal data. So being able to expand and build that data bank with quality and quantity data, and when you hear about what AI is able to take and data set and go into that predictive health, I think we're very excited at what lies ahead of us.
So you mentioned AI, you mentioned digital health there. Now we know they are changing and growing quite rapidly. How does HeraMed stay ahead of the curve in a very competitive space?
Yeah. Look, for us, the biggest thing is to work closely with our partners and our clients. What we have done in Broward Health demonstrate that we really have taken a customer first focus. Certainly, that's one of the elements that I brought in when I took on the role of CEO. So really looking at what they need, building that. We do R&D based on what is needed, and then we have a partner that is rolling it out in real world implementation. That's part of us staying ahead, as well as building other partnership. What we do very well, but it's one part of the whole ecosystem, and we know that, and we want to be very good at what we do in maternity, pregnancy, postpartum. We could expand on women's health, but then there's other players in this. So we have partnership with a research institute to build evidence base across the care outcome, the ROI, and the health economics of that, and as well as partnerships such as Garmin and other brands. So this is the building blocks for us.
What do shareholders have to look forward to over the next 6 to 12 months now?
Yeah. Look, US continues to be a big focus for us. So targeted sales effort and growing our US presence will be something that we should be looking out for. Continuing our partnerships and leveraging those, such as we have done, we've just announced with Garmin, but other big brands who play very well in this space of maternity and pregnancy health, but do things that we don't do and they don't have what we have. Should be looking out for those. Building evidence base through research, and that then links to our non-dilutive strategy around more grant submissions. So there's a few that are in the pipeline. Looking at some of the work we have done, we are expecting clinical trial report to be published coming out of Europe and as well as in Australia.
Anoushka, you've done a great job. Congratulations again on getting that Garmin deal. I'm sure it's going to be one of the first of many big deals. And thank you for coming onto our podcast with a very important topic. We really appreciate that.
Thank you. Thank you very much for having me.